Hi, this is Arun. I'm a certified professional coder. In this video, we're gonna see psychology billing and coding tips. These are all the common reasons why people look for psychologists. Stress, anxiety and depression, relationship conflicts, parenting and children, grief and loss, substance use, pre-procedural examination, other disorders like bipolar, ADHD, PTSD, etc., etc. In psychology, there are a lot of CPT codes are there. On this video, I'm gonna discuss few codes that I'm frequently using for my practice. Diagnostic code 90791 is for psychiatric diagnostic evaluation and re-evaluation. Evaluation means making a judgment. During the psychiatric diagnostic evaluation visit, the provider comes to a conclusion what kind of mental disorder the patient is having. The diagnosis can be found under the diagnostic impression on the documentation. 90792 is for psychiatric diagnostic evaluation with medical services. Medical services in the sense, while psychiatric diagnostic evaluation, the provider prescribes some medications. So that time we have to bill 90792. There is a rule coding guideline for the CPT code. Use this code only once per day, regardless of the number of sessions or time that the provider spends with the patient on the same day. Example, there is an evaluation done on 11/4/21. Procedure they mentioned like psychiatric diagnostic interview. The time is 10/1 to 11/17. Since it's a psychiatric diagnostic interview, we are not going to consider the time in and time out. So I'm going to bill evaluation date 11/4 with the CPT diagnostic psychiatric diagnostic interview 90791 and diagnosis pointer with a charge amount. Therapy codes 90832, 834, 837. These are all psychotherapy codes. Psychotherapy is to treat the mental and emotional health problem of a patient. These three codes are time-based codes. 90832 is for 30 minutes, 90834 is for 45 minutes, 90837 is for 60 minutes. If the psychotherapy done between the 16 and the 37 minutes, we can bill 90832. If the psychotherapy is done less than the 16 minutes, we are not allowed to bill 90832 or any psychotherapy codes. If the service is done between 38 to 52 minutes, we can bill 90834. If the service is done more than 53 minutes, we are good to go with 90837. Here I have three examples for psychotherapy codes. The first DOS is 10/22/2020. The time in is 13:20. Timeout is 13:45. Session is psychotherapy. 13:20 to 13:45. It means 30, 40, 45, 25 minutes. 25 comes within this CBT range, 90832. So I have bill 90832 with 1 unit with the charge amount. The next date is 11/15/21. Time in is 8:10. Timeout is 8:59. Session is psychotherapy. 8:10 to 8:59 means 20, 30, 40, 50, 59. It's like 49 minutes. 49 minutes comes within 90834. So I have built here 90834 with the diagnosis pointer and the charge amount. The third one is for start time 2:2 to finish time 3:1. Session is psychotherapy. 2:2 to 3:1 in the sense it's 59 minutes. It's more than 53 minutes, so I'm billing 90837 with $100 and the pointer is A with 1 unit. 90846 is for family psychotherapy without the patient present. This is for 50 minutes. 90847 is for family psychotherapy with the patient present. This is for the 50 minutes. 90849 is for multiple family group psychotherapy. Provider performs a psychotherapy session with a group of patients' families. 90853 is for group psychotherapy. Group psychotherapy is provided to a group of people sharing similar kind of psychological issues. 90839 and 90840 is for psychotherapy for crisis. Provider performs psychotherapy for crisis situation when patient is in life-threatening state and needs immediate attention. Here is an example. They have mentioned psychotherapy, crisis, end of life psychotherapy, duration is 120 minutes. During the notes, during the session, they have mentioned like met with patient at bedside in CCU. He was unresponsive to me early, but he did become more alert when wife presented to room and was able to mouth that he loves her. Here they have mentioned like the family all agreed that patient is suffering and they have been ready to transit to CMO, provided grief-based psychotherapy to patient's wife and her mother, explored ways to discuss end-of-life issues and patient passing with the children. 90839 and 90840 both are time-based codes. 90839 is for the first 60 minutes. For each additional 30 minutes, we have to bill 90840. So for that example, you can see the duration of the psychotherapy for crisis state, it's 120 minutes. 90839 is for 60 minutes, so I'm billing 1 unit, 60 minutes. 90840 is for each additional 30 minutes, so the remaining 60 minutes I'm billing 90840 with 2 units. And 90785 is for interactive complexity, mental health services complicated by communication difficulties. There is a guideline, coding guideline for using 90785. You can use 90785 in conjunction with psychiatric evaluation and psychotherapy codes and group psychotherapy codes. Coverable DX, always check whether the DX is covered under the LCD article and authorization. Some payer requires authorization for psychotherapy codes, so always check whether authorization is required or not before starting the service. That's all. Thank you so much for watching the video.